Tofranil, which is the trade name for Imipramine, is a tricyclic antidepressant medication that is used in the treatment of depression and anxiety disorders. Tofranil works by blocking the reuptake of norepinephrine and serotonin. And when the reuptake of norepinephrine and serotonin is blocked by the tofranil, this means that we have higher levels of these neurotransmitters available in the brain. Now, tofranil also blocks the muscarinic receptors, leading to antimuscarinic effects, and it blocks the alpha-1 and 2 adrenergic receptors and the H1 histamine receptors. And in this video, I will talk about the side effects of tofranil. And it is very important to know that every patient will have a different experience with the side effects of this medication, meaning that some side effects that will be present in some patients will not be present in others. So starting with the first side effects, and those are the antihistaminic side effects. So we mentioned earlier that tofranil blocks the histamine H1 receptors, and this will end up in some side effects that include dizziness, sedation, confusion, and increased appetite and weight gain. Tofranil also may lead to antimuscarinic side effects, and those are caused by the blocking of the muscarinic receptors done by this medication, and the antimuscarinic side effects include blurred vision that is caused by the paralysis of the ciliary muscles and the pupil dilation done because of the blocking of the muscarinic receptors. Also, we have constipation that is caused by the decrease in the gastrointestinal motility, and we have tachycardia, which is caused by the decreased vagal tone on the heart. And also in the antimuscarinic side effects, we have confusion, dry mouth because of the decreased saliva production, urinary retention, and that is caused by the inhibition of the bladder contraction. And we have cognitive impairment. Cognitive impairment is caused by reduced cholinergic transmission in the brain, and we also have precipitation of narrow angle glaucoma attack, and we also have paralytic ileus. Imipramine may also lead to cardiovascular side effects. So the imipramine effect on the cardiovascular system are due to its blockade of the adrenergic receptors, and this effect is also caused by its blockade of the sodium channels in the heart, which is similar to what the quinidine does. And the imipramine cardiovascular effects include orthostatic hypotension. Orthostatic hypotension is sudden fall in blood pressure upon standing, and this is caused by the blockade of the alpha-1 adrenergic receptors done by this medication, because the blockade of the alpha-1 lead to vasodilatation and reduced blood pressure upon standing. Imipramine may also lead to arrhythmias, and those are caused by direct cardiac sodium channel blockade, leading to conduction abnormalities. And imipramine may lead to QT prolongation, and that is thought to be caused by the blockade of the cardiac potassium channels. Tofranil may also lead to psychiatric side effects, and those include mania and hypomania. And mania is a state of a high mood with high energy and a very happy state, and that is caused by increased levels of norepinephrine and serotonin that can precipitate those manic episodes. And Tofranil may also lead to agitation, which is a state of extreme nervousness, and it's also caused by increased levels of norepinephrine and serotonin. Tofranil may also lead to delirium, and delirium is a state of hallucinations, agitation, and disorientation. And it is caused by the anticholinergic activity and possibly direct effect on the central nervous system by this medication. Tofranil may also lead to tremors, which is jitteriness, and it is thought that tremors are caused by elevated levels of serotonin and norepinephrine, and it may also lead to mild elevation in liver enzymes because it is metabolized by the liver, and it might lead to liver damage and elevated liver enzymes. Imipramine may also lead to sexual dysfunction in form of impaired arousal and impaired orgasms, and it is caused by the increased serotonin levels, and it is also may lead to diaphoresis, and diaphoresis is excessive sweating, and it is caused by noradrenergic receptor manipulation done by this medication. And Tofranil also have some hematological side effects, and those include leukopenia, which is decrease in the number of the white blood cells, and also it may lead to thrombocytopenia, which is decrease in the numbers of the platelets, and it may lead to agranulocytosis, which is decrease in all blood cells. And these effects are rare, and it is thought that they are caused by some autoimmune mechanisms on the bone marrow precipitated by this medication. There is also the risk of serotonin syndrome that comes with the Tofranil use. So serotonin syndrome is caused by the increased the serotonin levels, and it occurs in case of concurrent use with other drugs that also elevate the level of serotonin. Examples with the selective serotonin reuptake inhibitors, the triptans, the tramadol, the lithium, the St. John's wort, and the tryptophan. And symptoms of serotonin syndrome include altered mental status and autonomic changes such as tachycardia and neuromuscular changes such as tremor, rigidity, and myoclonus. And finally, Tofranil may lead to seizures. So imipramine lowers the seizure threshold by altering the neurotransmitter levels in the brain and increases the neuronal excitability. And this will increase the risk of seizures, especially in patients who are susceptible. And with that, we reach the end of this video. Thank you guys for watching. Please give us a like and subscribe.